Hello again. In this video, we're going to review the snap-in dentures. And the snap-in dentures come in two different categories. A snap-in denture with rings or locators, okay? Or a snap-in denture with a bar, okay? Those are the two options that those snap-in dentures come in. Now, just to kind of give you a visual of it, if we have see, they're pretty tight. So these are how the rings will look like, okay? They will stick out of your mouth, and this is usually how high they will stick out, okay? And then you'll have a denture that sits on top like this, and it clicks into place, okay? Now, if we're going with a bar option, okay, this is how the bar will look like. And this is how much it will stick out of the mouth, okay? And then on top of it, the denture goes like that and snaps in place. All right, so this option, either rings or a bar, okay? Now, let's talk about who's a good candidate. A good candidate is a patient that has an existing denture, but that denture just doesn't sit around. You have to put a lot of adhesive to keep it in place. It just moves around. A good candidate is a patient that lost so much bone and there's enough support for a conventional denture to give you the right retention. Also, a good candidate is a patient that maybe has a high anxiety, from worrying about the denture popping out when they're speaking or when they're talking in public. So this is a good candidate for those patients. Also, a good candidate is a patient that maybe have issues tasting their food with a full denture, because that sometimes can be an issue. Another candidate for this option is any patient that literally lost all their teeth and lost the support of the jaw to the face and the lip muscles, okay? So you get that droopy look. So those are a great candidate actually for this types of procedure. Now, let's talk about the pros and the cons. Now, on the cons side, okay, this is an option that we have to keep in mind. It's not a fixed-in option, so it will still move. You can still take it out. And with that in mind, we have sometimes that little movement that will cause some of the food to get under the dentures. So you'll have to take them out, clean them up, put them back in. Now, another con to this procedure is the fact that every year or two you have to change the engagers that hold your denture to the implant. Those are made of rubber, and over time they tend to wear out, and you'll have to replace them, and that's usually an additional cost to the treatment. Now, with that in mind, let's talk about the pros. This is a phenomenal option for a lot of patients that are just looking for a little bit more retention, because this is going to offer you, a much better kind of retention to your denture, where you're not really concerned about, putting glue every day or worried about, the dentures popping out. So most of that is resolved with this option. Also, it allows us to make the dentures not as bulky, and also allows us to kind of, for example, in the roof, on the roof of the mouth, to kind of open up all that space that usually is covered when we do conventional dentures. Now, with that in mind, that will actually also lead to a great benefit, which is you are going to taste your food a lot better once we open that area in the roof of the mouth. So that's definitely an increased benefit. Another benefit that a lot of patients don't think about is whatever you do at this stage, okay, we consider this a transitional stage from going from something that's completely removable toward something that's more fixed in. And all the investment that you've invested in putting these implants, those implants can be used at any time down the road to go from something removable to something fixed in at any time down the road. So it's not like you wasted all these implants if you change your mind. That's a lot of patients get that mixed up. But keep that in mind. This allows you to become in a transitional state and much closer toward a fixed-in option than anything else. And also, if we're looking at how long and how quick this treatment is compared to the fixed option, it's a lot faster. Usually anywhere between 3 to 6 months we are done and complete with the treatment, compared to a year to year and a half with those fixed options. That's definitely something that a lot of patients will see as a benefit. So putting all that together, it's definitely a great for lack of a better word, improvement from having a conventional denture to having a denture that's snap in and retained with those implants. The benefits definitely outweigh you living the rest of your life with something that moves around or you can't chew on it and whatnot. So I hope that puts in perspective how great this option is. And if you have any questions, I'm here.